So we're moving into the first new item, which is section J. My name is Charlotte Stininger, and I have the honor of presenting this for you guys today. And like Kathy said, we're running a little behind, so I'm going to hope to catch us up so we get to that break. We need that break, right? So, okay. Here we go. So just as with all the other presentations, we have our list of acronyms. You do have that list, like Kathy mentioned, in your folders. And our learning objectives for today for this section. So by the completion of this presentation, you will be able to describe the new health assessment items in section J, conditions, J1800 and J1900, and apply coding instructions to accurately code practice scenarios and the case study that we'll be presenting tomorrow. So let's take a closer look at the new items in section J, J1800, any falls since start of care, resumption of care, whichever is most recent, and J1900, the number of falls since sock rock, whichever is more recent. And the thing here that we want to look at are the time points that these items are collected. Notice they're at transfer, discharge, not to an inpatient facility, and death at home. This is exactly what this data set will look like for you on your OASIS-D. Note that J1800 has the skip pattern, which is a gateway question, and J1900 has 3 boxes. So you'll be entering a response into each one of those boxes. Now let's take a closer look at J1800, any falls since sock rock, whichever is more recent. So again, J1800, any falls, you're going to see that there are 2 responses, no or yes. And the no, you would wind up skipping J1900, but for the yes response, you're going to continue on to J1900. So let's look at the item intent for J1800. The intent is to identify if the patient had any witnessed or unwitnessed falls since the most recent start of care, resumption of care. So I think this is a good time to define some of the concepts within this element. Let's start with the word falls. A fall. A fall is an unintentional change in position coming to rest on the ground, floor, or onto the next lower surface. For example, going from like the standing position to like a bed or a chair. A fall may be witnessed or unwitnessed, reported by the patient or an observer, or identified when the patient is found on the floor or the ground. A fall is not the result of an overwhelming external force, like when a person pushes another person and they wind up falling. Let's think about an intercepted fall, because that's an important word that's within the guidance that talks about falls. An intercepted fall occurs when the patient would have fallen if he or she had not caught him or herself or had not been intercepted by another person. An intercepted fall is considered a fall for J1800. Another concept around falls for these measures, challenging a patient's balance. Now, CMS understands that challenging a patient's balance and training him or her to recover from a loss of balance is an intentional therapeutic intervention and does not consider anticipated losses of balance that occur during supervised therapeutic interventions as intercepted falls. So there were some really key concepts I want you guys to materialize. So the first one I really want to talk about is anticipated losses of balance. You're out there, your therapist is out there perhaps, challenging that patient's balance. You anticipate there could be a fall, you're ready. This is something you got to think about. And again, it's during that supervised therapeutic intervention. So let's move into the J1800 response-specific instructions. The instructions tell us that we can get information regarding the patient's history of falls through a variety of ways. First, review, right? We're going to review that home health clinical record, incident reports, other relevant clinical documentation, like a fall log, right? And then we're also going to interview the patient or caregivers about that occurrence of falls. And again, remember the time point that we're looking at since the most recent SOC rock assessment. Now that we reviewed some of the definitions and instructions, let's look at our other coding options for this item. So basically there are three. Code 0, no, if the patient has not had any falls since the most recent SOC rock. Code 1, yes, if the patient has fallen since the most recent SOC rock. Response-specific instructions, remember, include coding the falls no matter where the fall occurs. And a dash. A dash is considered a valid response for this item. However, CMS does expect the use of the dash to be a rare occurrence. And there you can see again, just as a reminder, what that item looks like. So let's practice what we've learned so far about J1800. Okay. So the discharging registered nurse reviews the clinical record and interviews the patient and caregiver, Mrs. K and her daughter Susan, determining that a single fall occurred since the most recent SOC rock. The fall is documented on a clinical note from the RN home visit in which Susan reported her mother slipped from her wheelchair onto the floor the previous day. So how would you code J1800 any falls since SOC rock? Is it code 0, no, or code 1, yes? I see the responses have come in. Let's go ahead and take a look at that answer. And the answer is yes. Good, okay. Remember, this item addresses unwitnessed falls as well as witnessed falls. Note how this is captured for the item. Let's try practicing yet another coding scenario. An incident report describes an event in which Mr. S appears to have slipped on a wet spot on the floor during a home health aide bath visit. He lost his balance and bumped into the wall, but was able to steady himself and remain standing. Okay, there's some key words in there. So let's take a look at how we would code J1800 any falls since SOC rock. Is it A, code 0, no, or B, code 1, yes? Okay, we have a couple of no's, a few no's here, some yeses. Okay, let's take a look at that. And the answer, okay, is yes, indeed. Remember, an intercepted fall is considered a fall for this item. So this is kind of fun. Let's do some more. Okay. A patient is participating in a balance retraining activity during a therapy visit. The therapist is intentionally challenging a patient's balance, anticipating a loss of balance. The patient has a loss of balance due to some hemiplegia, and the therapist provides minimal assistance to allow the patient to remain standing. Okay, this one is going to be a little tricky here. How would you code J1800 any falls since SOC rock? Is it code 0, no, or code 1, yes? Okay, answers are coming in. Oh, wow. Pretty solid response there. Let's take a look at the correct answer. Okay, so the correct answer is no. So let's think about this rationale. The patient's balance was intentionally being challenged by the physical therapist, so a loss of balance is anticipated. And when assistance is provided to a patient to allow him or her to remain in a standing position during an anticipated loss of balance during a supervised therapeutic intervention, this is not considered a fall or an intercepted fall. Shall we try one more? Okay, good, we're liking this. Okay, so a patient is ambulating with a walker with the help of a physical therapist. The patient stumbles, and the therapist has to bear some of the patient's weight in order to prevent the fall. Okay, a little similar, but a little different too, right? So how would you code J1800 any falls since SOC rock? Would it be 0, code 0, no, or code 1, yes? Okay, some responses are coming in. Looks like most people are thinking it's yes. Okay. So the answer is code 1, yes. We would actually consider that a fall. Let's look at the rationale for that one. The patient's stumble was not anticipated by the therapist. The therapist intervened to prevent the fall. Remember, now this would be considered an intercepted fall, right? And an intercepted fall is actually considered a fall for J1800. Okay, so now we're going to take a look at J1900. It's partner in crime. The number of falls since Sock Rock, whichever is more recent. Now this, just as a reminder, this is, again, one of the new elements in the OASIS-D. And this is how the new item will appear on the OASIS-D data set. Notice it's got responses for A, B, and C, and you will enter a response into each one of those boxes. Let's look at the item intent. The intent of J1900 is to identify the number of falls a patient sustained since the most recent Sock Rock and the category of fall-related injury. With that in mind, let's define some of the concepts associated with an injury related to a fall. Any documented or reported injury that occurred as a result of or was recognized within a short period of time, hours to a few days, after the fall, and attributed to the fall. That's what we're talking about when we're talking about fall-related injury. So, the response-specific instructions around J1900 fall into 4 categories: review, interview, determine, and code. Let's look at those. You're going to review the home health clinical record, incident reports, and any other relevant clinical documentation, such as fall logs. You're going to interview the patient and or caregiver about the occurrence of falls. You're going to want to know, have you had any falls? You're going to delve into that data, right? You're going to determine the number of falls that occurred since the most recent Sock Rock and code the level of fall-related injury. You're going to code the falls no matter where the fall occurred, coding each fall only once, and noting that if the patient had multiple injuries in a single fall, you're going to code the fall for the highest level of injury. Now that we've reviewed some of the instructions, let's take a little deeper dive into the coding of J1900. We'll start with J1900A, no injury. For J1900A, no injury, you're going to code 0, none, if the patient had no injurious fall since the most recent Sock Rock. Code 1, 1, if the patient had one non-injurious fall since the most recent Sock Rock. Code 2, 2 or more, if the patient had 2 or more non-injurious falls since the most recent Sock Rock. Now, a dash is considered a valid response for this item, but we expect the use of the dash to be a rare occurrence. But what does no injury mean? Let's take a closer look. No injury, when we're defining it, we're talking about there's no evidence of any injury noted on the assessment, no complaints of pain or injury by the patient, and no change in the patient's behavior is noted after the fall. Let's look at coding instructions for J1900B, injury except major. These are going to look kind of similar, but they are a little different, so let's take a look at those. You're going to code 0, none, if the patient had no falls with injury except major since the most recent Sock Rock. You're going to code 1, 1, if the patient had 1 fall with injury except major since the most recent Sock Rock. Code 2, 2 or more, if the patient had 2 or more falls with injury except major since the most recent Sock Rock. A dash is considered a valid response, and again, we're going to expect the use of that dash to be rare. What are some examples of injury except major? Let's take a look. Examples include skin tears, abrasions, lacerations, superficial bruises, hematomas, sprains, and any fall-related injury that causes pain, the patient to complain of pain. Now, though this is a list, it's not an exclusive list. I'm sure there are other examples that are not here. Let's look at the coding instructions for J1900C, major injury. You're going to code 0 none if the patient had no falls with major injury since the most recent sock rock. You're going to code 1 1 if the patient had one fall with major injury since the most recent sock rock. You're going to code 2 or more if the patient had two or more falls with major injury since the most recent sock rock. And again, the dash is a valid response. Let's look at some examples of how CMS defines major injury. These include bone fractures, joint dislocations, closed head injuries with altered consciousness, and then subdural hematomas. And again, this is not an exhaustive list. Now that we've reviewed J1800 and 1900 item intent, response-specific instructions, definitions, let's run through a few more coding scenarios. Get your Slidos ready. Okay, so a review of the clinical record and incident reports and patient and caregiver report identified that a single fall occurred since the most recent sock rock. The fall is documented on a clinical note from the from an RN home visit that describes the patient, Mr. R's, report of a fall that occurred between visits in which he tripped on the dog. This has happened, hasn't it? Fell against the wall, banged his elbow, sustaining a skin tear that he treated himself. Documentation of the RN assessment during the home visit details the healing skin tear and no other injury or symptoms identified related to the fall. Okay, so we're going to start with coding J1800 here. So how would you code J1800 any fall since sock rock? So is it code 0 no or code 1 yes? Okay, some answers are coming in. Looks like most of you guys think that this is a fall for J1800. Okay. We're going to get to that in a minute. Okay, let's move on. And the answer is 1. Yes, yes. Now look, there's your pattern. You're supposed to go to J1900, the number of falls. But let's take a quick look. Just as a reminder, this is a new item. I want to show you what this looks like again. So here we have, remember, 3 responses. So in that scenario for J1900, would it be code J1900A1, J1900B0, J1900C0? Or would it be code J1900A0, 1900B0, 1900C1? J1900A0, J1900B1, J1900C0? Or would you use a dash for A, B, and C? Looks like most of you guys, we've got 82 responses. It's going up. Okay, good. Okay, let's go ahead and take a look at the answer for that one. And the correct answer is C. Good. Okay. And notice how we put those codes in that actual data set. You see, we need a response, an answer for all 3. So the rationale is that the documentation of only one fall since the most recent sock rock was identified, and the laceration is considered an injury except major. Okay? So let's try our hand at another coding scenario. A review of the patient's record, incident reports, and patient caregiver report identified that 2 falls occurred since the most recent sock rock. The falls are documented on the clinical notes. The first describes an event in which Mr. G tripped on the bathroom rug, almost fell, but caught himself against the sink. The RN assessment identified no injury. Key words there, right? The second describes an event in which Mr. G, while coming up the basement stairs with a load of laundry, fell against the stairs and sustained a bruise and laceration on his left knee. So let's take a look at J1800 here. Would it be code 0 no or code 1 yes? Okay. Getting a good amount of responses in for this. And it looks like most of you guys feel like this is, actually all you guys feel like this is yes. And the answer is indeed yes. And then with that, again, we're going to move on to J1900. So again, just a quick look at the item to familiarize yourself with what that looks like. And so what do we think about the coding of J1900 in this scenario? Is it A1, B0, C0, or A1, B1, C0, or A0, B1, C0? Or would you use a dash for all three? And it looks like responses are coming in. Most of everyone is choosing B. We have a few C's in there. Okay, let's think about this. Okay, so the correct answer actually is B. Well done. So again, you're going to see A with 1, B with 1, and C with 0. And the rationale. The first fall is an intercepted fall, which is considered a fall. The patient sustained no injury as a result of this fall. The second fall resulted in a laceration and bruising, considered an injury, but not a major injury. Okay, that was good. Well done, guys. Okay, let's take a look at another scenario. The review of the patient's record, incident reports, and patient and caregiver report identifies a single fall occurred since the most recent sock rock. The fall is documented on an incident report, which describes an event in which Mrs. J fell while walking from the bedroom to the bathroom and was transported to the emergency room via ambulance. Examination and testing revealed a skin tear on Mrs. J's left hand, bruising on both knees, and a fractured left hip. Okay? So with that scenario, how would you code J1800? Is it 0, no, or 1, yes? And that's a pretty resounding yes. Okay. Looks like we got most of the answers in, and the answer is indeed yes. So yeah, we're going to move on to J1900. And remember, just again, orientation to what that looks like. You guys are going to be getting used to seeing this now. How about J1900? Is it A0, B1, C1? Is it A1, B1, C0, A0, B0, C1, or a dash for A, B, and C? So we have a few people thinking it's A, but a majority of you guys think it's C. Okay, let's take a look at what the right answer is. And the right answer is indeed C. There was that one fall, and it indeed was a major injury. What was that major injury? The fracture, right, good, okay. Excellent. Okay. So now we're going to summarize J1800 and 1900, more the concepts associated with this. And we're going to do this with a few knowledge checks. So don't put away Slido quite yet. We have a few more things. So J1800 and 1900 are not completed at which of the following time points? Is it A, transfer, B, discharge, not to an inpatient facility, C, sock rock, or D, death at home? Okay. Answers are coming in. Okay. Ooh, we got a little bit more variance here. This is good. Okay. So the correct answer is sock rock. Well done. Remember that J1800 and 1900 are completed at transfer, discharge, not to an inpatient facility, and death at home. Let's look at one more knowledge check here. Which example below does not meet the definition of a fall? I know we reviewed that some time ago, but let's go back to that. Is it Mrs. T reporting losing her balance while going down the stairs but catching herself on the railing to remain standing? Or Mrs. B's daughter reporting that her mother fell while walking to the mailbox? Is it Mr. W reporting that he reports falling after being pushed by his roommate? Or do they all meet the definition of a fall? I hear you guys. See. Let's take a look at the answer. And the answer indeed is C. And why is that? He was pushed. It's an overwhelming external force, right? Okay, good. Okay, guys. So we're going to spend the next 9 minutes or so to go over a few other things here with regards to the application of the percent of residents experiencing one or more falls with a major injury. And, we're going to take these next few minutes to really better understand the quality measure and how it will be reflected on the reports. We want to know the data, right? We're collecting it. When are we going to see this data, right? And then what is exactly being captured? Okay. So this measure reports the percentage of quality episodes in which the patient experiences one or more falls with major injury during the home health episode. Okay, so that's pretty telling, right? Remember, major injury examples include bone fractures, joint dislocations, and closed head injuries with altered consciousness or subdural hematomas. We can all understand why this one, of all the stuff we talked about today, this one is the one that's going to define the quality measure. These type of injuries are quite impactful, and we know that firsthand, don't we? And better understanding the rate of fall related to this type of injury is going to be a very important quality measure for us all. So let's think about some of the concepts and other things to consider with regards to this measure. Like Kathy mentioned earlier today, a big drive for this is to make sure we have cross-setting quality measures that meet the requirements of the IMPACT Act. This is currently adopted for the calendar year 2020 in the HHQRP program. Data for the measure calculation is going to be submitted via the OASIS. It's one of the OASIS elements, right? The quality measure is based on data reported from two items. Now, I know we talked about one, but let's think about this. J1800 is that gateway item, right? Because if you answer it no, you're going to skip right over 1900. So that's an important component of this. So when you look at it, J1800 is included, and then J1900 asks for the number of falls with A, no injury, B, injury except major, and C, major injury. So again, the measure is calculated using the data reported for J1900C, a number of falls with major injury. And one other component, this measure is not risk adjusted. So understanding how it's actually the formula for it, we're going to look at the numerator over the numerator over denominator. Whew, getting tongue-tied. The numerator being the number of quality episodes in which the patient experienced one or more falls that resulted in major injury during the episode of care. And again, this is J1900C, right? And that will be divided by the denominator, which is all quality episodes that are eligible except for those that meet the exclusion. So let's look at some of those exclusions. The denominator exclusions are quality episodes that were excluded because one of the following is true, okay? Either the occurrence of falls was not assessed, okay? We don't want that, right? Or the assessment indicates a fall occurred and the number of falls with major injury was not assessed. So we have to look at that. Numerator exclusions are going to look pretty familiar, right? Your maternity patients, patients less than 18 years of age, your non-Medicare, Medicaid patients, or patients who are not receiving skilled home care services. So public reporting of this data is going to be on the CMS Home Health Compare website, but it requires that the agency has at least 20 observations for this quality measure and that you've been in operation for at least 6 months. Okay, so in summary, any falls since Sock Rock and J1900, the number of falls since Sock Rock, are completed at transfer, discharge, not to an inpatient facility, and death at home. An intercepted fall is considered a fall, and falls are coded regardless of where the fall occurred. You got to think about that, because sometimes our falls are happening when the patient goes and sees the doctor, right? So how are we capturing that? Are we capturing that? CMS does not consider the anticipated loss of balance that occurs during a supervised therapeutic intervention as an intercepted fall. So we understand we're out there, we're trying to challenge our patients, we're trying to build their strength, right? So that might happen as long as we intercept that, okay, and we anticipate that. There are 3 levels of fall-related injury, right? No injury, injury except major, and major injury. And the applications of falls, quality measure that was adopted for calendar year 2020 in the HHQRP to meet the requirements of the IMPACT Act, report falls with major injury during the home health episode. Okay. So, what we'd like to see is you guys go to your Slido and look at your, I think there's a question section, or the area where you can actually share your ideas and your action plans. We like to make this stuff real for you guys. We know that there's a lot that you're managing out there, and this is the time to think about J1800 and 1900, and to think about how you're going to be operationalizing these questions, right? There's a few things you gotta think about. So we're inviting you to share those ideas with us, pull out your action plan, start writing some of this stuff down. Some things that come to mind right now is, how does your agency track falls? Falls during the entire episode of care. How are we doing that? Is everyone reporting on falls? Are you guys using incident reports? Think about some of that. Do you have a place in your EMR clinical record where you expect to have all falls and the level of injury identified? So it's one thing to report it, but for these measures, we also need to know what is that level of injury. And then another thought I want to leave you with is, who is doing the discharge or transfer visit? In some ways, that could be your nurse that did the start of care, or it could be someone altogether different. So think about that. And what is your expectation? How are they going to gather that data to ensure accurate coding for J1800 and J1900? Okay. And with that, I think my time is up. So thank you.